Hi, this is a nursing professor here to give you your 5-minute roundup for March Madness. So today we're going to talk about hyperthyroidism and hypothyroidism. So one is up high, one is down low. And so when we talk about these thyroid hormonal imbalance, let's look at hypothyroidism first. And that's when you have a low or insufficient amount of the thyroid hormone. And so typically the thyroid hormone that you're deficient in is either T3 or T4. Sometimes you're TSH. The cause of this could be congenital. People sometimes are born with it. It could be result from an inflammatory process, iodine deficiency, which we don't see much in this country, or a person who had a thyroidectomy where they had either a partial or full thyroid removal because of some sort of disease process there. So those who are at risk are typically females between the ages of 30 and 60 years old. Those who may have taken certain medications, for example, lithium and amiodarone, could lead to a low thyroid hormone imbalance. Also, people who receive radiation of the head and neck could also have that hormone diminish or decline. Some signs and symptoms you might see is fatigue, lethargy, people who sleep like greater than 16 hours a day, so it's extreme. Irritability, intolerance to cold, constipation, because everything tends to slow down. So it's weight gain, constipation. They might be pale in color. Their nails and bones typically get very thick and brittle. Many times suffer from depression or apathy, just not interested in doing much of anything. Joint pain, muscle pain, also the cardiovascular system can be impacted, so they will have bradycardia where the heart rate slows down, hypotension, blood pressure tanks, or different dysrhythmias, and those of course are atypical heart rhythms. They could have slow thought, slow speech, hair loss, dry skin, swelling of the face, tongue, feet, or hands. So those are all signs and symptoms you might see with a person with hypothyroidism. Some labs that you would use to diagnose would be, of course, T3, T4, levels could be low, also TSH, as I said earlier. You would also look at blood cholesterol. Your cholesterol levels might be up high because going back to that cardiovascular outcome of having a low thyroid hormone. Let's see, the way we diagnose this is using a thyroid scan. Also, an ECG could be helpful because, again, thinking of those dysrhythmias a person could experience. It's very, very important for the person to avoid laxatives with fiber, because if a person has a low TSH or T3, T4, they might be given a supplement. That supplement is typically levothyroxine, also known as Synthroid, which should be taken on an empty stomach. So usually that's to be given before breakfast. We should caution when we use that because it can be impactful if a person also takes warfarin, which is a blood thinner, insulin, or digoxin. Those levels could all be thrown off. So we use it very cautiously with people who take that. There's also one more term you need to be familiar with when we talk about hypothyroidism, and that's myxedema. And that is a life-threatening condition when a person suffers from hypothyroidism when it goes untreated or poorly managed, or a person that has chemotherapy. Now, one of the other things to note with this is that it can be very difficult with diagnosing in the older population or elderly population where things tend to slow down. You know, if you have an 80-year-old, for example, who starts to say, oh, I'm really tired, then you might not necessarily think thyroid. So that is one of the things that you're going to keep in mind when you're thinking of hypothyroidism. So now let's check out hyperthyroidism, and this is when you have excessive circulating hormones. The thyroid gland has, again, three hormones, T3, T4, TSH. And so these hormones are regulated, of course, by the anterior pituitary gland. So many times people who have excessive thyroid hormones, they end up with what we call a goiter, where they have a really huge swelling of their neck. And it goes hand in hand with thinking about where the pituitary is, that would make sense. So some causes of hyperthyroidism is autoimmune disease, unexplainable. You have these autoimmune antibodies that result in hypersecretion of the thyroid hormone. And so you have a person who suffers from what we call Graves' disease, and that's when the person has a toxic amount of the hormone, and so that has to be treated. You can also associate thyroiditis, toxic adenoma, a toxic nodular goiter, which is usually not very common, because sometimes women do end up with nodules on their thyroid, and they get removed and there's no problems there. And an exogenous, meaning outside of the body, hyperthyroidism can be caused by excessive dosage of the thyroid hormone. So just as we talked about hypothyroidism, if a person is given excess amount of thyroid supplement like the Synthroid, then it could go opposite, where the person ends up with signs and symptoms of hyperthyroidism. So some of those symptoms include nervousness, irritability, hyperactivity. This person is moving a lot, emotional lability. You don't know which way they're going. Decreased attention span, change in mental or emotional status, weakness. They'll also have excessive intolerance to heat, whereas hypothyroidism was intolerance to cold. Weight loss, increased appetite, insomnia, everything is just revved up in the person that has hyperthyroidism. You can also imagine that if it's female, then of course they could have problems with the menstrual cycle as well, with either or. And as opposed to constipation that you saw in hypothyroidism, you would see diarrhea. In hyperthyroidism, you will also see that the person gets these really bulging eyes, and it's called exothalamus. They can get the enlarged goiter that I talked about. And some of the complications of this disease could be a person suffers from a thyroid storm, where that's really challenging to manage. Okay, so those things are really critical when they happen. And last but not least, some of the medications you might see are the thioniamides, beta-adrenergic blockers, iodine solutions, radioactive iodine therapy, and a thyroidectomy, which could be either partial or full, to actually remove the thyroid. And of course, that person would have to get artificial replacements if the whole thyroid is removed. Some labs you will look at, of course, is T3, T4, TSH, which is the same with hypothyroidism, an ultrasound of the area, electrocardiogram, because you do get these dysrhythmias as well, and you only can imagine if someone has excess hyperthyroidism that they could really get a very fast arrhythmia. And a thyroid scan is frequently used. So that is it. Hypo and hyperthyroidism, both of them are equally uncomfortable for our patients, and so we have to make certain that we consider nursing considerations, which is keeping our patient comfortable and looking at signs and symptoms and trying to address that. So I said 5-minute wrap up, that's 9-minute wrap up. So anyway, this is a nursing professor, March Madness. Bye for now.